Thank you for volunteering to be a patient for the final year medical student exams. Your help is very much appreciated. In this short video we will demonstrate what will happen when you attend the exams as a volunteer patient. Should you have any questions, concerns or suggestions after watching the video, then please do not hesitate to get in touch with us. Contact details are enclosed with this video and shown on the last screen. Thank you. Prior to attending, we will phone you to check your details are correct, book your sessions and arrange your transport. We will organise a taxi for you that is paid for by the hospital. This will drop you off at GTEC and home again afterwards. We'll arrange the most appropriate vehicle for you to take into consideration any mobility needs you may have. If you wish to drive, we can arrange a parking permit. However, parking in the afternoon can be difficult, so a taxi may be easier. Sometimes we ask for extra patients to attend in case someone is unable to make it at the last minute or is ill on the day. If you are asked to do this, you will be warned in advance. Reserve volunteers are essential to ensure we can run the exams effectively. You will receive a taxi, catering and a thank you voucher in exactly the same way as a patient who stays for the exams. If you are a reserve patient, we will confirm within 1 hour of you arriving whether or not you will need to stay. We will ask you to arrive for 8:30 for morning exams. You will be offered lunch when you have finished and you will be free to leave by about 1 p.m. For afternoon exams, we ask you to arrive for 12:30, ready for lunch. You will go into the exam room at about 1 p.m. and you'll be finished by about 4:30. You will only be asked to attend for a morning or an afternoon session. All volunteer patients are changed halfway through the day to ensure students don't work out who is in each room and to prevent volunteer fatigue. Refreshments are provided at the start of the session, during the break and at lunchtime. If you have any special dietary requirements, please do let us know. Once we are ready to start the exams, a member of the exams team will escort you to the appropriate room where you will meet the 2 examiners and may be asked to change into a gown. The examiners are hospital doctors. They will not be specialists in your illness. This is intentional so that their expectations of the student are at the correct level. The examiners will only see your medical details for the first time shortly before they meet you in the exam room. Again, this is intentional. The examiners will briefly discuss your health problems with you, checking your history, symptoms and medication.
Hi, so it's John March, is that
right?
right?
Yeah.
My name's Dr Wilkinson, this is Dr Chan.
Okay.
So you've got a history of COPD, is that right? That's
right,
going to
yeah.
be the focus for the students, isn't it, during the examination? So when exactly were you diagnosed?
Probably about COPD, probably about 6 years ago, 5, 6 years ago.
Okay, and you've got a list of your medications with you, haven't you?
Yes, I have, yeah.
Okay.
They will discuss what sort of questions the students might ask you and guide you in how to answer if you are unsure. The examiners may carry out a short examination, for example, listening to your heart or checking your pulse. This is so that they know what the student should find if they do the same examination.
So, Mr. March, right now I would like to have a listen to your chest at the back. Is that all right?
It's fine, yeah.
Okay. Breathe in.
Before the exam starts, there will be a sound check of the bell and chimes. You will hear this in your room. Please let your examiners know that the volume is adequate. We suggest you wear loose, comfortable clothing as you may be sitting in a chair or asked to move onto an examination couch. If the student might need to examine your chest or tummy, we may ask you to put on a hospital gown. You might prefer to bring a dressing gown to put over the hospital gown and a pair of slippers so you don't need to put shoes back on at the break times. If your leg might be examined, you might prefer to wear shorts. Assistance will be available should you require it. When you arrive, you will be greeted by a member of the exams team. We will ask you to sign a consent form. We will also ask you to complete a medication list. You may prefer to complete the medication list at home before attending. A copy of this will be sent to you with your letter. You will then be escorted to the volunteer patient waiting area and offered refreshments. When the exam starts, a bell will ring. The first student will enter the room and hand their marking sheets to one of the examiners.
I'm Paul.
Okay, Paul, take a seat. Mr. March has a history of breathlessness. Can you explore these symptoms further?
No problem. Nice to meet you so much.
Each student has 10 minutes to ask you questions about your illness. Please answer as briefly as you can.
So what I'd like to talk to you about today, Mr. March, is your breathlessness, if that's okay.
That's fine.
Would you mind telling me a little bit more about that?
It's probably started about 5-6 years ago, mostly through coughing. A bit of phlegm comes up, mostly just white, nothing else in it.
At 10 minutes, you will hear a chime. This indicates time for the student to move on to the examination.
Okay, what would you like to examine and why?
I'd like to examine the respiratory system, please.
Yep, okay, go ahead.
Thank you very much.
The student will start to examine you.
Right, John, what I'd like to do is have a look, listen and feel to your chest, if that's okay.
That's fine.
Some of what I'm going to say I'm going direct to the examiners, if that's okay. So if you've got any questions, please don't hesitate to ask. So examining John from the end of the bed, he seems to be comfortable at rest, he's not using accessory muscles of respiration, and he doesn't seem to be breathlessness. There's no paraphernalia around the bed, and he doesn't have any walking frames or anything. Would you mind holding out your hands for me, please, John? So, doing these, the temperature is equal, and there's no signs of muscle wasting or clubbing. Would you mind holding your fingers together like this for me? That's lovely, thank you very much. Next, I'm going to feel the pulse, which is nice and regular and rated around 60 beats per minute. That's fantastic. Would you mind facing that way for me, please?
The JVP is not elevated.
And would you like me to elicit the fat and jugular reflex?
No,
That's fine.
Fantastic. And I'd like to elicit the blood pressure if I have time as well. Thank you. Next, I'd like to have a look in your eyes, John, if that's okay. Would you mind taking your glasses off for me? And just look up for me. That's fantastic. So next, I'd like to have a listen to your chest. If you could take a deep breath in and out through your mouth when you feel my stethoscope on your back. That's fantastic. And again.
At the end of the 5 minutes, a bell will sound and the student will leave the room.
Thank you very much for talking to us, John. You can cover yourself back up.
Thank you.
Thank you very much.
Thank you.
The student goes to a quiet study room where they will write up their notes and come up with a plan of how they would manage your illness. Whilst the first student is in the quiet room, the bell will go again and the second student will come into your room. This second student will now ask you questions about your illness. Please again answer as briefly as you can.
Hello, President Capetto.
Yeah.
Okay, this is Mr. March. He's got a history of breathlessness. Please explore these symptoms further.
Hello, my name is Prisley Chinkapete. I'm one of the final year medical students here, and I've been asked to speak to you a bit more about your breathlessness. Is that okay?
It's fine, thank you.
Can I please confirm your name and date of birth?
My name's John March, and date of birth the 27th of March, 1958.
At 10 minutes, you will hear a chime. This indicates time for the student to move on to the examination. The student will be asked to examine you, and they have just 5 minutes to do this.
Okay, so what would you like to examine?
I'd like to examine the respiratory system, please.
Okay, go ahead.
Thank you. Hello, Mr. March. Is it okay if I examine your chest today?
Yes, certainly.
That will just involve me having a look at your hands as well as your face and some of your legs as well as listening to your chest. So, Mr. March, have you had this kind of examination done before?
Yes, yes.
Great. So if you just let me know if you're uncomfortable at all at any point, if that's okay. Okay, Mr. March, it's come to the point now where I need to listen to your back. Is it okay for you to lean forward
Yes,
for me?
fine.
Now what I'd like you to do is just take some deep breaths in and out through your mouth with the mouth open.
At the end of the 5 minutes, a bell will sound and the student will leave the room.
Thank you very much, Mr. March. That concludes my examination.
Thank you.
The second student will then go to the quiet study room where they will write up their notes and come up with a plan of how they would manage your illness. A bell will sound again and the first student returns. The student will be asked by the examiners to explain what they have found out.
Hi, everyone, take a seat.
So could you please summarise the relevant findings from the history and examination?
So I spoke to John, who is a 65-year-old retired company director. He presented with cough and breathlessness on exertion. He had no evidence of hemoptysis in his history and he had no fevers.
The examiners will ask the student questions. Sometimes questions are about a similar condition to yours, but not specifically about you. During this time you will hear the chimes again. This warns the student when they have just 5 minutes left.
Okay, so can you go back to Mr. March now and explain to him about having a peak flow test done?
Sure, no problem. So hello again, John. What I'd like to talk to you today about is the peak flow. So have you used one of these before?
Yeah.
Okay, so it's a way of us measuring how your lungs are doing from day to day, morning to evening. It involves you blowing as hard as you can through it to try and get the highest possible number.
After 15 minutes, the bell will sound and the student will leave the room.
So I hope that's answered all your questions today, John. Thank you very much for talking to me and I wish you all the best in the future.
Well, we wish you all the best for your future too.
Thank you.
The bell will sound again and the second student will return to do the same things.
Okay, just take a seat again, Jessica. Thank you.
So could you please summarise the relevant findings from your history and examination?
Okay, I spoke to a gentleman today named John March. He's a company director, aged 65. He presented with a history of increasing shortness of breath that he's had over a chronic period of time.
During this time you will hear the chimes again. This warns the student when they have just 5 minutes left.
Okay, if you want to go back to Mr. March now and speak to him about what would be involved in having a peak flow test.
Okay.
Hello again, Mr.
May I?
March. I've just been asked to speak to you now about using a peak flow. Now this is the device that I'm speaking of, a peak flow device. Have you used something like this
Yes,
before?
I have, yes.
Okay.
After 15 minutes, the bell will sound and the student will leave the room.
Well, Mr. March, thank you very much for your time. I hope that you're happy with using the peak flow meter now. Do you have any further questions?
No, I don't, but thank you for your time too.
Fantastic. Thank you. Thank you.
Thank you.
You will be asked your opinion of the students at the end of each session. This does not affect the student's final grade. If you are concerned by anything that the students say, please do discuss this with the examiners at the end. You will then have a break. After the break, the process is repeated again with 2 new students. You will see 4 students in total.
Why do you have reserve patients?
We have reserves in case someone is ill on the day. We only have 1 or 2 reserves each day.
How long do I need to stay for if I am a reserve patient?
You will need to stay for the first hour.
Can I say no if I don't want to be a reserve patient?
You can say no to anything that you don't want to be involved with. Please make it clear when we book you in if you'd rather not be a reserve.
How will I know what time to arrive and what time the exam will finish?
We will let you know in a letter sent to you before the exam what time you need to arrive for and the time that the exam is expected to finish by.
Do I have to pay for my taxi?
No, all transport is arranged on our account.
Can I drive?
If you decide to drive, we will provide a complimentary parking pass. Parking can be difficult by lunchtime, so we suggest you let us arrange a taxi for you.
Should I let you know if I have specific dietary requirements?
Please do let us know if you have any allergies or specific requests.
Why do I have to switch my phone off?
The exam cannot be interrupted by phones going off. If you are expecting a call, please leave your phone with the exams team, who can take a message for you.
How long will I be in the room for?
You'll be in the room for approximately 1¼ hours in the first round, followed by a 10 to 15 minute break, and then another session of approximately 1¼ hours.
How many times will I be examined?
You will be examined 4 times in one morning or an afternoon session.
Can I bring a friend or carer?
You're welcome to bring a friend or carer if they would normally accompany you to an outpatient's appointment. They will need to wait in the refreshment area whilst you're in the exam.
Can I have a chaperone?
As a female patient, if your examiners and the students are male, you'll be offered a chaperone. This will be one of the nursing staff of the exams team. If you do not require a chaperone, just let the exams team know.
Can I request female examiners?
We cannot guarantee a female examiner, however we can offer you a chaperone.
What should I do if I don't feel well, either before or during the session?
If you feel unwell before attending, please let us know. We will phone you to check you're okay before the day, however please do contact us at any time if you are concerned. If you feel unwell during the exam day, please let a member of the team know immediately. If you feel unable to continue with the exam, you should tell the examiners. You can ask to stop at any time.
Will the examiner know all about my condition?
The examiner will not be an expert in your illness to make sure the exam is fair for students. An expert might be expecting too much of a student.
Why does the examiner need to ask me about my condition and examine me?
The examiner will not know about your history until the day of the exam. They will want to make sure they have a full understanding before the exam starts.
If I have lots of different illnesses, which one should I tell the student about?
The examiners will discuss this with you at the start of the exam before the student arrives.
What should I do if the student asks me directly what is wrong with me?
Please tell the student. Don't try to ignore the question or refuse to answer. The examiners will take this into consideration.
Can I talk to the student if they finish early before the bell goes?
Unless the student asks you a question, please just sit in silence until the bell goes.
What should I do if the student takes my medication list with them?
Please let the examiner know so that it can be returned before the next student comes in.
What should I do if I don't understand what the student said about my illness?
Please ask the examiners to explain further after the student has left the room.
What should I do if the student leaves me uncovered?
Please ask the student to cover you with a blanket.
What should I do if the student says something that worries me?
The student or examiner might talk about your condition, but not specifically about you. If anything concerns you, please discuss this with the examiners after the student has left the room.
Will my opinion influence any decisions about whether the student passes or fails?
No, the examiners will make the decision based on what they see and hear. They will ask you what you thought, however this will not influence the result.
Will I be paid?
We will give you a £10 High Street gift voucher as a token of our appreciation.
Will participating in the exams affect my treatment?
Being a volunteer patient has no impact on the clinical treatment with your consultant. Sometimes you might hear new information about your illness and wish to get more information about this. You can ask the examiners at the end of the session to explain, and if need be, they will discuss with your own consultant further.
Will I get to know if the student passed the exam?
Unfortunately, we were unable to give you this information.
Hello, my name is Professor Vinod Patel. I'm a professor at the University of Warwick Medical School. I specialise in teaching clinical skills. I'm also a consultant physician at the George Eliot Hospital NHS Trust, working in diabetes and acute medicine. Thank you very much for agreeing to take part in our clinical examinations. Our students do train with simulated patients. So a simulated patient can pretend that they've got chest pain or low mood and many other conditions, but it is not the same as testing a student on real patients with real problems. This is going to be towards their final examination, so it's very important to ensure that our students are going to be good doctors when they are in the wards and in general practice. So on behalf of George Eliot Hospital NHS Trust and other local hospitals and the medical school and future patients, I really would like to thank you for taking part in the clinical assessment. I hope you enjoy the day.